Wait.
So welcome back to episode 46 of Taking Charge of My Cancer podcast. And I have a great colleague of mine. His name is Bryan Groleau. I hope I'm spelling it right. Bryan has been a lymphedema and a wound therapist since 2003 with experience in breast cancer-related lymphedema and axillary web syndrome, lower extremity obesity-related lymphedema and lipedema, head, neck, and facial lymphedema, stage 3 elephantiasis, geriatric mixed edemas, lymphatic filariasis, and lymphedema in the home health setting. Through his career, Bryan has treated extensively in both outpatient and home care settings and managed teams of lymphedema and wound therapies for multiple clinics and home health agencies. Currently, he is the director of clinical education for mediUSA and also serves of the Medi for Health Medical Missions project to treat and educate of lymphedema and wound care for those with lymphatic filariasis in Haiti. So Bryan, advocacy, lymphedema, and wound care is his passion. So Bryan, thank you so much for being here with us tonight.
Thank you so much, Shirley. I appreciate being here. Yeah, 20 years in lymphedema seems to be. Hold on. Can you stop the recording? I'm so sorry.
So welcome back to episode 46 of Taking Charge of My Cancer podcast. I have with me a great guest tonight, Bryan Groleau. He has been a lymphedema and a wound therapist since 2003 with experience in breast cancer-related lymphedema and axillary web syndrome, lower extremity obesity-related lymphedema and lipedema, head, neck, and facial lymphedema, wound care and stage 3 elephantiasis, geriatric mixed edemas, lymphatic filariasis, and lymphedema in the home health setting. Through his cancer, Bryan has treated extensively in both outpatient and home care settings and managed teams of lymphedema and wound therapies for multiple clinics in home health agencies. Currently, he is the director of clinical education for mediUSA and also serves on the Medi for Health Medical Missions project to treat and educate on lymphedema and wound care for those with lymphatic filariasis in Haiti. Educating clinicians on advanced lymphedema and wound care is a passion of Bryan. So thank you for Bryan for being with us tonight.
Thank you. I appreciate it. Man, that's when I hear the list of stuff, it's been forever. It's been 2003. Like makes my head spin. It's 20 years.
Now, exactly.
Exactly.
So we go back. I think we met. How long ago do we met? We met when I've been doing oncology for like what 15 years now.
Yeah.
So I guess we met in one of those times, right?
It wasn't long, I don't think, after you started. I met some of your colleagues way back in 2010. That's when I started first coming to Gainesville. I came to Gainesville because I used to work for Tactile Medical, and that's, I think, probably maybe when I met you. I know I met Shannon as well. So yeah, it was a long time ago.
Yeah, exactly. So were you always were planning to do this? Just being a therapist and then work in the lymphedema world?
Well, let me put it to you this way. Like when I went to school to learn occupational therapy, I had no idea that I would ever be a lymphedema therapist. Of course, when I got into lymphedema, I literally got into it because I had moved to St. Augustine, Florida from New Hampshire, and I had finished college and whatnot, but I took a break from therapy. I was doing pediatric therapy, and I moved to Florida, and I was like, I was, young, and I just felt like taking a break from therapy. So I did. I took a break from therapy and cooked pizza for a year at a pizza shop on St. George Street.
That's a big difference.
Yeah. And then I said, all right, that was fun, but I need to get back into doing what I know to do, which is therapy. And I literally responded to an ad in a paper where they were like, we want an occupational therapy assistant for lymphedema therapy. And I responded to it and I interviewed for the job. I'm like, look, I have no idea what lymphedema is. And I don't think anyone had a clue what lymphedema was at the time. And I said, but it sounds intriguing. one-on-one with the patient. I am very much, I like spending time with people and getting to know them and truly trying to see what I can do to help. So I'm interested. Let me see what this is about. And I took that job. I got the job, and I ended up working at the clinic for 4 years in lymphedema. And at the time, nobody knew what lymphedema was,
Mhm.
and we really weren't. We were a pretty steady clinic, but there were days when I didn't have the caseload because people didn't know to refer it. They just didn't know. And I spent a lot of extra time with patients and really trying to understand lymphedema and really become a better therapist. And that really helped me a lot. That set my career off. I learned that I love treating lymphedema, and I kind of got pretty good at it from all the extra time that I spent at it with my downtime. So it's pretty cool. Good, good start. I had no idea I was going to do it forever, and here I am, 20 years later, and I don't think it's ever going to change. I do love the profession and what we do, and it's very meaningful, and I've learned a lot. And yeah.
So tell me a little bit of this transition between being in the clinic versus being where you are, and you can tell the audience a little bit about what exactly is Medi and what are you doing and how was that transition?
Good. Yeah, that's a good question. So throughout my time in lymphedema, I've kind of just things just progress. Is how it goes, and I because I got into it so early and learned how to treat it effectively, I then started getting positions where I was a clinical director of the lymphedema clinic, and then I would help bring people on and train them. Next thing I knew, I'm training people in lymphedema. Then uh, I switched and worked for a home health agency, and they didn't have a lymphedema program. And I went to them and I said, well, let's put a program together. And they were all about it. And so I put a lymphedema program together for a home care company in Jacksonville. And then I'm mentoring other therapists. And one thing leads to another. I become an instructor for lymphedema so I can certify people in lymphedema. I did that through ILWTI. And then it just got to the point where, well, I just kept on moving forward. And an opportunity came up with Medi to kind of come on their education team. And I was all about it because one thing that I love is meeting therapists, meeting other people and learning what they do and collaborating. And then if there's anything that I can offer in education, um, I'm happy to do that. And working for Medi was kind of that just next step of getting further along in education, expanding my footprint, if you will, in the lymphedema world, and just kind of casting the net even wider with people and with the education that I can provide. So
Yeah.
it was an easy next step. I do miss treating patients, and but I love being able to travel, meet therapists like yourself. Some of the products that I've been able to work on and put together as well. Some of these things would have never happened had I not crossed that bridge from therapy into working for Medi or working in industry. So
Yeah.
pretty,
Want to
pretty crazy.
explain a little bit what is Medi for the people, the listeners who are that's no
Yeah.
idea what it is.
So Medi is a manufacturer of medical compression for lymphedema. They also make compression for vein disease and for wound care. And Medi doesn't just do compression. We have an orthopedic line, we have a wound care line, we've got a foot care line. But for the sake of what we're talking about today, Medi is one of the leaders globally in medical compression for lymphedema. And they've been at it. This is, I want to say, their 76th year in medical compression. And coincidentally, I just got back yesterday from Germany, where I went to the head office and manufacturing and production. Unbelievable. It's just an unbelievable thing to see how all of that is done and orchestrated. So yeah.
Oh my God, I wanna hear more about it. So I'll be asking you more questions about that. So will you give the audience like 3 valuable tips that you learned about your journey?
About my journey in particular, I will tell, I learned a hard lesson in my early days, and I always refer back to my early days. Like when you're a new therapist, you think that you get all this information, and you think you can just uh, heal everybody. You think you're just a hero or something maybe. And I remember this one patient that came in the first year that I was a lymphedema therapist, and she had, and back in those days, 20 years ago, radical mastectomies were still a thing, and people would come in with stage 3 lymphedema in the arm, which I don't see as much anymore, which is very good. I'm glad I don't. But this poor lady had a very, very large arm. She had significantly reduced function as well. And I explained to her the entire what she came in. This is a lymphedema clinic, and what can you provide for me? How can you help? And I explained everything about CDT to her in like 15 minutes. Here's what we're going to do. We're going to bandage you up. We're going to do massage. You're going to come every single day. I'm going to spend an hour and a half with you, and I'm going to teach you how to wrap. I'm going to teach your spouse how to wrap. I just unleashed everything all at once. That patient walked out the door, and I never saw her again. She never came to therapy. And so, one thing I have to say is, it's not that I don't want to give everyone all the information at once, but maybe sometimes giving it to people in a more palpable way. And I don't want to withhold any information from anybody, but at the same time, it's good to be careful not to overload people and give them too much at once. Baby steps, like, what do they need to know? And overwhelming people with information is something that I try not to do anymore. I try and find out and listen to what, you know where they're try to find out where they're at with things, and what they need to know, and what I can tell them in the moment that they're in, to kind of uh, accept and deal with what they've got, because gosh, they've been through so much already,
Yeah.
and then to have to go through all of it, it's just too much. It's way too much. And I still find the newbies out there whenever there are some people out there that still like to unload all at once, and it's like there's no rule that says you have to give all this information at one time. One thing at a time. It's kind of a rule of thumb now with everything. It's like, even with my own kids, it's like there's no rule that says I have to tell them everything at once if they ask me a question. Just give them enough. So,
And this is so true, but at the same time, I think that you have to be really clear with the patient, right? Because we know that in this case, lymphedema is a chronic disease, right? And if you don't take care of it, it's only gonna get worse. And sometimes patients get tired of it, right? So patients with chronic lymphedema is like, I'm done with sleeps, I'm done with doing MLD every day, I don't want to do this anymore, and they just give up. And then they come to therapy when they know, again, it's like, oh my God, the sleeps doesn't feel anymore. I gotta do something about it again. And they come back, and sometimes some patients just don't really feel that. I don't think that it's not like they don't want to be in charge of it, but I think that it's easy to find, can you do it for me so I don't have to do it myself, right?
yeah.
Because it's just easy if somebody else does it for us. And so sometimes it's not a bad idea to explain in very lime terms what is it that this whole CDT means, but for them to realize that they gotta compromise, right? Because if they're not gonna compromise, it's not gonna work, right? So if they come expecting to, oh, you're just gonna give me this soothing massage on my arm, and this is gonna make it all feel better in a long term, they're mistaken, right? So I think that it is nice to maybe not give everything at the same time, but make them realize their compliance is what's gonna make anything to happen as a good outcome or not.
Yeah, and I think exactly, what you're saying has really changed my approach with people and patients in general. Um, with compression, for instance. We know we need it round the clock. Ideally, we have daytime compression, we have nighttime compression, we have all the tools in the toolbox, sometimes pneumatic compression as well, whatever, right? But some people are like you said, I'm tired of doing MLD. I'm tired of compression or wearing whatever. And I think what changed for me is like, okay, my job is, yes, to teach everybody compression, teach everybody the works of what we do for CDT. But a new part of the aspect of the job, which we don't learn in school, is how to help somebody navigate a good quality of life living with lymphedema. And I know that's not a phrase that I came up with on my own, living with lymphedema. That's something I think maybe somebody wrote a book on at some point. But the point is like, how can I meet this person's needs where they're at and teach them how to do all this stuff, still live their life. Maybe, and for some patients, for me, it was like, okay, what is it going to take for you to feel like you're living your normal best life? Is it going to dinner? Is it going to church? Is it going to, and if it is going to church or going to dinner or going to a social event, is not wearing compression going to make you feel better about yourself? If so, and you want a 2 hour break from compression, wear your compression in the car, take it off before you go, put it back on when you get in the car. It was all about trying to help people navigate this new world of lymphedema and live their life with it. And if that meant that, and as long as they had the right product to come home to, like, okay, if you're going to swell up a little bit, then do you have a garment that's going to reduce it back down? Are we going to keep you from getting infections? What is the main goal? And if we can prevent all that stuff from happening, to me, it was just all about the balance and helping people find that balance of lymphedema, keeping up with it. Like, it's just not easy to do. And I think that's our hardest job as therapists, is helping people find that balance.
Yep, you're right. But it is super exciting with everything that has been new with lymphedema, that all the research and this surgical options and so many great things that we can do, from even preventing lymphedema at the time of surgery. That's what one of the surgeons I work with do. So at the time of an axillary dissection, we do a LV bypass, so that's decreasing the percentage of breast-related lymphedema quite a bit. So
Yeah,
so many great things now that perhaps were not 20 years ago or even 15 years ago when I started doing this. So I
it's crazy.
it is amazing, and I'm super excited to see all the research coming up. Shannon was in the symposium at Boston, and it was so great to see all the changes, right? Like, oh my God, this is not what we thought was gonna be before, with the anatomy of the lymphatic system and the drainage paths and all the stuff that we learned being a CLT. And now we were like, okay, we're switching how we teach people this now. We just did a lecture at the UF PT with the PT students.
Mhm.
We do, a lecture on lymphedema and oncology, and we just did it on Friday. And we were telling the students, perhaps what we were taught in you guys a year ago, we are not teaching you today. So, and perhaps what we're going to be teaching you in a year, or the next group, perhaps it's not going to be what we're teaching you today, which is super exciting, because that's exactly, we want to see changes and try to really have everyone update into what those changes are. So, all right, so you gave me one tip. What will be another two tips?
Another two tips. Um, on what? Well, first of all, uh, I think listening first is probably a really important thing that I've learned. Really trying to, listen to what people need, what people are able to do, what they're not able to do. It kind of goes back to what I said earlier of I was always ready to just start talking, and now it's really sitting back and trying to listen to what people's needs are. I think that can be pretty helpful. And knowing that not everyone's the same. Gosh, right? I don't know why it's so hard to learn that lesson, but everyone's different. Everyone's going to react differently, and one thing that we always talk about in the medical world is the word compliance. And then that word changed from compliance to adherence. And we, tend to talk about people as if in terms of how compliant they are. But I also kind of added another word to it, and I added the word capable. And I think sometimes we use the word compliance and capable interchangeably, and they mean two different things. Some people just aren't capable of doing some of the things that we need them to do, or we want them to do, that they need to do. And whether it's because they physically can't do it, or because maybe they're mentally not able to do it, or they're, like you said, they're tired and they just don't want to do it. So listening is important. And I guess that third tip is really looking at capability of people, and looking, foreseeing how long is that capability going to be around for. If you be capable for the rest of your life, then great. And if you're going to be capable for 5 years, great. But looking at the long, people forget that lymphedema, we know it's a lifelong condition, but we oftentimes don't remember. We don't talk about it. We don't teach about it as if it were lifelong. We talk about it as if it's happening now. You're with me for 2 to 8 weeks, or whatever the case may be, but trying to remember and put yourself in the patient's shoes, that this is for the rest of their life. So what we set up today might not be set up for tomorrow, and we can always come back and modify it and change that. So yeah, there you go.
That's very good tips. How about the most painful lesson that you learned through this journey?
The most painful lesson, I think, is thinking that I can do more than I really can. I'm only one person, and you're always as good as the knowledge of the person that's treating you, and the experience of the person with you. And I think for me, it was just about discovering that not everyone's going to have the same ending, right? Not everyone's going to have the same reaction and response to therapy. And sometimes, you look back and is that a reflection on me and my skills as a therapist, or is it something else? So to me, the most painful part is getting out of my own way, and going back to the basics of listening to what's going to be most appropriate for somebody.
Yeah, that's very powerful. Sometimes, we don't know it all, but we can have a system that we can refer to, or I have a fortune to work with great colleagues where we always like, hey, I have this case, what are your thoughts, what else can we do differently? You've been super helpful, like just when you have a new product, and I remember in the beginning tried to do these circuit kits, and they just tried to, just like, you guys were like, oh, you can cut this, you can really do it, and we were petrified of doing it. It's like, I'm no messing up something that is costing money to my patients, and there is no chip, and then I'm just gonna go ahead and cut it wrong. And like, no, we were like totally like, no. I always have to call Caroline, like, nope, you come and you do it for me. We are not gonna do it. Yeah. And then finally we were like, so she gave us the encourage to just go ahead and do it. And now you're like, great. And now you guys coming up with new products. Just like a couple of weeks you were here showing us the new products for head and chest and breast, which is amazing. So again, we always have such a nice network that we can always reach out to and say, what are your thoughts? And we're going to talk a little bit more about your project on the head and neck garment, but that kind of like, it's so great to see you and NLM presenting this. It was like really cool to see, like, oh my God, we talk about this as a project and here it is. So that's really cool.
It's crazy
So
how long some of the processes take. That's the painful part too. Like we started talking about this like 3 or 4 years ago. Of course, the pandemic didn't help anything with the timeline, but finally, we're like, yes, with the last NLN, there we finally are talking about these things that we've been
which is,
talking about forever.
but it is so great. It is so great. Is anything that you have that will be of value for our audience, and will you share that with us?
Um, yeah, I think reaching out and knowing your resources is always a good thing. Um, Therapists are a wealth of knowledge, and of course, the ones that have, some of us have more experience than others, but it doesn't matter because we all, even there's nobody can know it all. And if I don't know something about head and neck, who am I going to get on the phone with? Early, right? And if maybe you have a patient that's got a wound, maybe you'll call me because we all go, we're all in the same circle. So, you know, it's always good to stay in contact with people that care for you. And if there's not something that we know, we're gonna find an answer. We're gonna reach out to our colleagues. We're all well connected. It's a small group of people, and it's a growing group of people. But yeah, I'd say the best tip that I can give people is to stick with it, one step at a time. You don't have to be a hero. Just take it one step at a time, and then once you get something down solid, then you can move on to the next one. It just it goes back to the conversation of how it's lifelong. It's a lot of CDT. Is a lot to it. Self MLD, one step at a time. One step at a time.
Yep, absolutely. How can people find you?
Well, people can find me through email for one, and I don't mind sharing my mediUSA email. It's Bryan .Groleau at mediUSA.com. My name is Bryan Groleau at mediUSA.com. So that's one way. I am on Facebook. I am not big. I'm not a big social media person. I'm on there, but I'm not very busy on there. I don't post anything. I'm on LinkedIn. You can find me on LinkedIn. You'll never see a post from me, but anyone that wants to contact me, I get direct messages from Facebook and LinkedIn all the time, and I keep those accounts open so that people can find me. And if they want to reach out, then I will get the notification and I will eventually reach out. But people find me on LinkedIn all the time, and then that works.
Perfect. And I will actually put that on the notes on the description of the podcast so people can see that. So, um, what type of resources would you advise to patients to maybe look into it as they dealing with lymphedema, due to cancer, or even not necessarily due to cancer? It's a little bit different, but yeah, what type of resources would you advise them?
Um, I'm pretty big on utilizing the National Lymphedema Network is a good resource, and of course they have all of their resources listed on there. I'm also on the board of LANA, the Lymphology Association of North America, and they also have their website which has resources on it, and they're connected with the American Cancer Society, and everything runs into each other. I know that Learn is also another good resource for people with lymphedema. I also recommend people looking up some of their, more local chapters of cancer organizations, American Cancer Society. I know that there's Lighthouse Lymphedema up in the Atlanta area. So, there's a lot of different places where people can go online to find information out. Um, and all of those I think are really good. I think that the NLN provides a lot of good resources. Um, and the thing about the Lana website is it's of North America, so there's some other Canadian. Um, if you've got any listeners that are, from Canada, there's also some the Canadian lymphedema, I forgot what it's called, but those websites are all on the Lana website, and you can find all that stuff. So there's lots of good places for people to get information.
And then I want to ask you one of one of the last questions is, will you explain to the audience a little bit the difference between wrapping, like if you have swelling of your arm and you go to therapy, as therapists talk to you about, we do this thing called CTT, which is complete decongestive therapy, where we will do skincare and manual lymphatic drainage, compression, and exercise. So will you just tell us a little bit about, what is the advantage of a reduced circuit, and you can explain what that means, versus wrapping, for instance?
So the Circade is an adjustable hook and loop system. It's got straps that have hook and loop on them, like a Velcro system. Bandaging is something that you've got to put multiple layers of bandages on, whether it's with cotton and rolled foam, and then however many layers of bandages you need to properly compress the limb to give it enough compression to reduce the swelling. And it's also got to be applied in a specific way so that you've got a higher pressure more distally or at the bottom of the limb, and that pressure slowly reduces as it goes up the limb to make sure we've got flow from the bottom up into the trunk of the body. You want to move that fluid from what we call distal to proximal, basically from the bottom of the arm up to the top. That's the proper way of the flow. With the Circade system, it doesn't use multi-layers of bandages. It uses a system of straps that have hook and loop, and you can tighten those straps. The huge advantages to using something like a Circade are a few things. One, you're able to just readjust compression at any given time. If you're someone that bandages, you have to basically undo all of the bandages to reapply them. And one thing we've learned about bandages is that they really start to reduce in their pressure. Even within 2 hours, you can have a reduction of pressure by 50%. And if you're not going to be rebandaging till the next day, you're going to be waiting all that time when you need to replenish the compression to the limb. So if you've got something adjustable, you can just literally quickly within seconds just readjust the straps and you replenished your compression. And what it offers is this consistency in compression that maybe can expedite the reduction process. Other things about them is that patients can put them on, take them off themselves. That improves sometimes hygiene if they want to take a shower or shower, bath, whatever. They can take off their compression, get in the shower, and put their compression right back on in a matter of minutes. Whereas bandaging is not going to be a matter of that quick. It'll be a matter of minutes, but it's going to be many, many minutes. And so the speed, the consistency of compression, hygiene, all of those things are a big reason why people navigate toward using a Circade. Independence, faster reduction, hygiene. Those are three big things. If I was a patient needed compression, I would want all those things.
Okay,
that's why I use it.
Yeah, that's exactly what I was going to ask you. You're a lymphedema therapist, 20 years of experience, and work with all these multiple, lymphedema, other therapists educating. So that will be your preference to go to. That will be the Circade.
Yeah, it is my preference. And when I was in the clinic, I would give my patients an option. I'm happy to bandage. I love bandaging, and I made a craft at it. After 20 years of lymphedema therapy, you get pretty good at it, So I'm happy to bandage anybody, but I'll always give them the option of Circade, because if it were me, that's what I would want. I would want that, and just to know that there's something that I can put on myself, and I can still take my shower in the morning.
Yep.
That's a big deal.
Yeah. It is one question you wish I will have asked you, and will you have answered it?
one question that I wish you could ask. Well, um, you know, did we talk about what I like to do for fun?
No, that will be a really good question. Yes,
I think it's important that everyone has their thing in life that they like to do. And
absolutely.
and for me, if it means anything to anybody, having that thing that you do in life where you don't have to think about anything, it's just you enjoy it. It's important. It's important to have those kind of escapes. For me, I live in St. Augustine, Florida. The reason I live here, the reason I moved from New Hampshire to Florida, we're bringing this full swing right to the end, is because I love surfing.
Oh,
I
okay.
used to surf in New Hampshire, and I would surf year round, and it was cold. It was
Oh,
cold
wow.
all the time, but especially even in the winter. I just got tired of that, and so I moved to Florida because I wanted to learn. I wanted to feel what it was like to get in the warm water and surf waves without having to wear a
That's so
wetsuit.
cool.
Yeah. So
So do you do that all year round?
yeah, and I do here too.
And
Great.
no wetsuit
What's that?
winter? No wetsuit even in the winter?
Oh, you wear a wetsuit in the winter here. You can go to South Florida for the warmer water, but I don't mind wearing a wetsuit. But I had to wear it all year around in New Hampshire, and so down here it's not bad. You can pick and choose your days down here. It's
Nice.
that cold out, and just stay out of the water. But it's yeah.
How often do you surf a week?
I try if there's waves, I'll go before work. Like if it's depending on what time of year it is during the summer, like I can get out there around 6:30 in the morning and surf before work if I'm not traveling. And then if I am traveling, then I'll try and hit some waves on the weekends and stuff. But life is different, it can get busy. So you might go a couple weeks without surfing, and you miss it and you get back to it when you can. I've been traveling a lot lately, so I haven't been surfing that much, but I'm about to get back into it. So
Nice, nice. Does your kids or your wife surf?
I've been teaching my kids how to surf. My daughter can catch some waves. She's 11, and she's learning how to surf. She's pretty good. My son's younger, so he's still a little nervous of the waves, but he'll body surf them. And my wife is just happy to sit on the beach and read a book and watch us.
That's cool. That's kind of me. I can live on the beach, just lying in there,
Nice.
taking sun, having a nice cocktail, uh,
Yeah, exactly.
or just walking, just swimming. But yeah, I try surf a couple of times. It's hard, and then it's like, maybe, yeah, maybe not.
Yeah,
So yeah,
sitting
so
on the beach,
like a
fine
little,
too.
yeah, body surfing. That's it. Yeah.
Yeah, exactly.
All right, Brian. Well, thank you so much for doing this with me. I really appreciate your time and really giving a nice information, a valuable information to the audience. I really appreciate it.
Thank you. I really appreciate it too.
All right. You have a great evening.
You too.